Hi, Dr. Frank here with another EKG video. In this video, I want to go over a left bundle branch block pattern and Scarbosa criteria. I've made some training videos on this in the past, but I just want to review this again. So recall in protocol 2.11, Scarbosa criteria is a STEMI equivalent. We're going to be moving in the future from calling just STEMI, ST elevation MI, to changing that to OMI, occlusive MI, because there are disease processes that we see that aren't ST elevation MI that are, acute coronary syndrome or STEMI equivalents. And that includes in our protocol isolated posterior STEMI and Scarbosa criteria. And more and more are coming through the literature, such as De-Winter T-wave patterns and a couple of others. So, but on this video, I want to go over left bundle branch block pattern and Scarbosa criteria. So on the screen here, you see two separate EKGs. One is a normal left bundle branch block, which is on the left. So this is a normal left bundle branch block pattern. And I want to review the Scarbosa criteria. So Scarbosa criteria are number one, concordant ST elevation of 1 or more millimeter, so 1 or more little box, in any lead. Criteria 2 is concordant ST depression of 1 or more millimeter in any lead V1 through V3. So you only need 1 millimeter of concordant ST depression in V1 through V3. And finally, the third is what we call as a modified Smith-Scarbosa criteria, which is excessive discordance um, of ST elevation. So what excessive means is that more than 25% of the ST elevation to S ratio, or more than 0.25 of the ST elevation to S ratio, and I'll go over that. So you have to just meet one of those three criteria, and that's a STEMI equivalent. So we can see in the first tracing, what I do when I look at left bundle branch block and try to read for STEMI, I start with determining whether everything is discordant. And again, discordant means that the ST depression and the T wave go in the opposite direction of the QRS complex. So here we have an upward deflection of the QRS complex, and there's some ST depression and T wave inversion. So that's normal. That's what we want. And if you look at the entire tracing and you ask yourself, in every lead, is it discordant? Then you're basically done with the first two criteria. Because remember, the first criteria is concordant ST elevation, and the second criteria is concordant ST depression. So if you go through every single lead and you say that every single lead is discordant, then you're done with criteria 1 and 2. So let's go through real fast. So we've identified already that lead 1 is discordant, right? Lead 2 is discordant. The ST elevation here is in the opposite direction of the QRS complex. Lead 3, discordant. There's ST elevation, but it's the opposite direction of the QRS complex. So discordant, 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 discordant. I would say this is isoelectric, which is fine. Discordant, remember the ST elevation is in the opposite direction of the QRS complex. Isoelectric or discordant. This is discordant, 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 and discordant. Okay, so remember, discordant means that the ST elevation, which is here, goes in the opposite direction of the QRS complex. So every single lead here is discordant or possibly isoelectric like we see in V2, which that's fine, but I would say that there's probably some elevation there. So anyhow, every single lead here is discordant. So you can already say that you've eliminated criteria 1 and criteria 2 just by looking at every single lead and saying that they're discordant. And now you want to look and see, is there ST elevation that's excessive, meaning that the ST elevation to S ratio, so ST elevation to S ratio, is it ever greater than 0.25? Is the ST elevation ever bigger than a quarter of the QRS complex? Okay, and you can see just by looking at these leads that nowhere is it excessive, right? So let's look at V3. V3 has maybe, let's just be conservative and say that there's 3 millimeters of ST elevation here, right? And the QRS complex is 5, 10, 15, 16 millimeters, right? So if we say 3 over 16, that's 0.18, so that's not 0.25, so it's less than 0.25, less than a quarter, then you're good. Okay, so that's how you identify the ST elevation to S ratio. Okay, so we can very confidently say that this is not a STEMI or not a STEMI equivalent and does not meet Scarbosa criteria. Now, let's move over to the next tracing. And let's go, and this is going to be very brief because we're going to see that it meets the Scarbosa criteria. So we're going to start with, like I said, my way to look at these is to start by saying, is everything discordant? Remember, discordant means that the ST elevation, let's go back to the first tracing, the ST elevation goes, or the depression goes in the opposite direction of the QRS complex. So the QRS complex is up, ST depression is down. QRS complex is down, V3, ST elevation is up. Okay, so you want everything to be discordant. Okay, so let's start. Lead 1, discordant, right? So the QRS complex goes up and the ST depression goes down. Is there discordance here? QRS complex goes down, and then wait, what do we find? The ST elevation is in the same direction, so it's concordant. You could be done, right? You could be done. You call a STEMI alert, we activate the cath lab, the patient goes for left heart catheterization and primary and PCI, right? So you're done. But let's just go over this even more. You see the QRS complex here is a little bit difficult to tell in that first lead, but the QRS complex goes up, and again, the ST elevation goes up. So that's concordant ST elevation. Look at AVF. QRS complex is basically up, and the ST elevation is also up, concordant ST elevation. But you could be done if you wanted to, because all you need is one lead. You don't need two contiguous leads. You just need one lead. Let's just keep going. This is discordant. This is isoelectric. V1 is either isoelectric or discordant. V2 is isoelectric. V3 is a little difficult to tell, but that's probably discordant. V4 is isoelectric, and then we're coming back in and seeing more ST elevation. V5, primarily the QRS complex goes up, and the ST elevation also goes up, so that's concordant ST elevation. Again, QRS complex goes up in V6, concordant ST elevation, right? It should always be discordant. So this is an inferior and lateral STEMI, but again, if you wanted to stop at finding lead 2, concordant ST elevation, you could be done. Okay, so again, step 1, make sure everything's discordant. If everything's discordant, you eliminate Scarbosa criteria 1 and 2, and then if everything is discordant, look for excessive discordance. Okay, so if this ST elevation is a quarter of the QRS complex, you're also able to call a STEMI alert. This second tracing is a great example of Scarbosa criteria. This patient had an RCA occlusion, an inferior STEMI. Again, because you have concordant, meaning that that the ST elevation goes the same direction as the QRS complex. You have concordant ST elevation. So the more and more you look at these EKGs, and the more you develop your own pattern, if you want to use the technique I use by making sure everything's discordant and then looking for excessive discordance, or you want to come up with your own methodology, that's fine. So, but this is a great example of a left bundle branch block pattern that meets Scarbosa criteria. So if you have questions, please keep reading and reach out. I hope this is helpful. Have a nice day.